Hi, Dr. Hagmeyer here again, and what I want to do is I want to welcome you to this side of my site. Either you or a loved one is really searching for a solution on really how to correct and get rid of these chronic headaches and migraines, and that's what I'm really excited to share with you and really go over with you today. What I found is that in well over 90% of the patients over the last 15 years is that there are a number of factors that are contributing in one degree or another to all of these chronic headaches and migraines that you continue to have. What I try to tell people is that it's not just one cause as to why you're experiencing these ongoing chronic headaches. It's what we call multifactorial. And it's these factors that once we've identified them and we address them can really put an end to the headaches, the dizziness, the light sensitivity, the equilibrium, the vertigo, the nausea, the neck pain, the fatigue, the irritability, and the tension that you feel in the muscles throughout your body. Now, when it comes to chronic headaches and migraines, you probably realize that there is no way that you can continue going down the path that you've been going. There's no way that you can continue taking the medications that you've been taking without them having some repercussion and really toxic and ill effects on the long-term future health of yours, okay? If you've been taking medications for the pain, I wouldn't be surprised if these medications have already got on to create new problems and just create new symptoms. So what I want to do in this video is I want to jump into these 5 factors that are really just creating this ongoing circle, this merry-go-round of headaches and migraines that you continue to experience, okay? So the first factor is what we call neuroinflammation. And neuroinflammation really means that your brain is literally inflamed. We read a lot of information and been hearing a lot about inflammation in the mainstream media about inflammation and its links to various chronic diseases like heart disease and strokes. However, brain inflammation is just as much a problem and in fact much more serious because if it's left unchecked, it causes actual degeneration of the brain. And we call that neurodegeneration. Now, brain inflammation and neurodegeneration is like a low-grade fire burning in your brain, and it's extremely hard to put out once it gets started and once it's really had an opportunity to do its damage. It'd be like having a fire burning on the top floor of a 100-story building. And that's a significant problem for a lot of people that have these chronic headaches and chronic migraines, okay? Factor number 2 is what we call delayed immune food sensitivities, okay? There's a dizzying amount of information and research out there on just how food sensitivities really trigger headaches, how they trigger migraines, how they even trigger depression. And these are not just food allergies, but rather these are what we call delayed food sensitivities. And having tested several hundred patients over the last 15 years, most headache sufferers unknowingly suffer with some degree, some immune food sensitivity that is going on and contributing to just a chain of events that really just continue to trigger these ongoing chronic headaches and ongoing inflammation. Now, an immune sensitivity to a food is when the immune system abnormally reacts to the proteins in the very foods that you're putting in your body each and every day, okay? What happens is once your body identifies these proteins, it vigorously goes on to attack these proteins as it would any other foreign invader, like bacteria or parasites. Now, day in and day out, like I said, day in and day out, it's the foods you eat that could be one of the causes to these unrelenting headaches, okay? Now, the thing that confuses most doctors and even a lot of patients alike is that in many cases, they don't cause stomach pain. They don't cause GI symptoms. There's no nausea, there's no gas, there's no bloating, there's no diarrhea. There's none of these gastrointestinal symptoms. But I want to really stress here that this doesn't mean that this chronic problem doesn't exist. Now, finding, correcting, and fixing the damage caused by this food sensitivity and the irritation and the inflammation process in the gut is really a linchpin in the migraine treatment approach that we take here at our office. Factor number 3 is hormonal imbalances, okay? Now here's the thing. Hormones like estrogen, testosterone, leptin, thyroid, cortisol, these are all psychoactive chemicals, meaning that they excite the brain, they excite the neurotransmitters, they change brain chemistry. Now more and more doctors are obviously recognizing the link between hormone balances and chronic headaches and migraines, but the bad thing is that if they recognize them and when they recognize them, almost every single time traditional doctors that are trained in traditional allopathic medicine skip the very next most crucial, critical step. They don't stop and ask the question, why do these hormones become imbalanced? And again, this is just a problem that I see over and over and over. And what I see happening for many women, especially women, okay, because they're the most vulnerable to this, is that they will be put on some sort of hormone pill, some sort of cream, some sort of hormone injection. And this is just a huge, huge disservice to many women. Now, factor number 4 is what we call the brain-gut connection, okay? This is a huge missing link for so many chronic headache and migraine sufferers. In our bodies, we have just a vast network of blood vessels. We have these blood vessels in our head, we have them in our stomach, we have them obviously in our brain. And when these vessels begin to expand and contract, or even spasm, vasospasm, it triggers a massive pounding headache. And many chronic headache sufferers have functional weaknesses in various parts of their brain that control and influence the direction of how these blood vessels open and close, dilate and constrict. Okay? Now, this loss of functional control really leads to this never-ending barrage of headaches. It leads to a never-ending barrage of CTs and MRIs and brain scans and brain studies. And then, of course, the end result of that is we don't see anything. There's no tumors, there's no cancer. And that now leaves many chronic headache sufferers and migraine sufferers on a lifetime dependence on medications. Obviously, when this happens, patients are given that virtual life sentence of headache and medication designed to treat those symptoms. And that's what I'm really against, okay? When you suffer from a functional brain weakness, it requires a very, very precise functional neurological examination followed with a customized set of brain activities and really exercises that are designed to strengthen that very part of the brain that is weak, right? And that should make sense, because if all we do is just throw a bunch of muscle relaxants or a bunch of painkillers at the headache, that fails to address many of those other factors that we've been talking about, and we're going to continue to talk in this video. Factor number 5 is cervicogenic headaches. Okay, now a cervicogenic headache is a very, very common form of headache. It's a contributing factor to other kinds of headaches. And these are headaches that really originate from some sort of structural or nerve deformity or even a nerve entrapment, usually somewhere in the neck. Usually it's the upper part of the neck, but sometimes it can be in the lower cervical vertebrae. Now, again, these are problems that are related to postural problems. These are problems that often occur in people that are sitting behind a computer desk all day long. They're staring at a monitor. Many people often think that the headaches that they're having is actually due to, muscle strains and the weakness of the eyes. But what we find is that more cases of these cervicogenic headaches, they're stemming right from these postural problems, and very often these postural problems that go on to cause a loss of the nice cervical, what we call the cervical curve or the cervical lordosis. And it's these muscular imbalances, either on one side of the neck or the other, that go on to entrap and really structurally injure and inflame these nerves, okay? So you see here's the thing. Your neck serves as part of a structural protection of the spinal cord. So if you can imagine a bunch of donuts stacked one on top of the next, and in the center of that donut, there's a little opening. That's where your spinal cord sits. And it's through just various micro and macro traumas that occur throughout the lifetime, starting, in fact, as early as the birthing process, all the way through car accidents and car crashes and roller coaster rides and sports injuries and sports traumas, that these structural components of the neck become affected, and that then goes on to affect the functioning of these nerves. So again, this can be another major cause of chronic headaches. What I would tell you is that it's similar to having a car that is slightly out of alignment. And slowly, what happens is the tires, because they can't rotate evenly, they begin to wear out, right? And so you can keep on replacing the tires because the tire wear and the tire groove is wearing out at an accelerated rate, or you can actually just simply fix the misalignment and your tires just continue to last much longer. You get more life out of them. Well, the same is true when the neck bones and the muscles become functionally misaligned or they become unbalanced. They begin to cause a network of nerves that travel to the back of the head to become trapped. Now, what this all boils down to is that a bigger picture requires really a whole person approach, right? We have to take a very functional approach. We have to kind of step back in many cases, and we have to ask ourselves, why is this happening? Why is this person having a headache, right? Hopefully, after watching this video, it should be glaringly obvious that at this juncture, you've not even scratched the surface of really what's causing these ongoing chronic headaches, okay? There's not a pill in the world that'll ever solve these underlying issues. And that's really why headaches become chronic in the first place, because the cause is never corrected or uncovered. Now, the only sound approach is really to thoroughly investigate these sources and then functionally go about correcting the problem. And this is exactly why our method and the approach that we take here in our office works so successfully. Let me close this video with just a short story of a lady who I spoke with on the phone recently. This was a young lady. She was in her 30s. She called our office, and while I was on the phone with her, she just began telling me about her health. And over the course of a few minutes, she just really began to break down. She broke down in tears. And she had been having these chronic headaches that have just been, getting to the point where she was experiencing them every couple of days. And they were literally just putting her out of commission. They were affecting her sleep. They were affecting her job. She was a teacher. They were affecting her husband, her mood. But the straw that really broke the camel's back, that really caused her to become motivated to take action and call our office, was when her son came into her room one morning and he asked his mom if they could go on a bike ride and a picnic. And she told him that she couldn't because she wasn't feeling good. And the little boy said, "Well, that's okay, Mommy. I know you're having a bad day again." And as the little boy closed the door, sensing his disappointment, she realized that she was losing out on many of the precious moments in life. Many precious moments that are gone in literally the blink of an eye. One of them, obviously, being time spent with her son. Are you missing out on those precious moments like this? Okay, perhaps you have a similar story. And this is really why I've done this video. If this is happening to you, if this is really just robbing you of your life, I don't want you to wonder what your life could have been like in 10 or 15 years or 5 years from now. If what I've just talked about really just makes sense to you and you're looking for a program that really digs in deep into the cause of your problem, you're not looking for more Band-Aids on a gushing wound. If what I've just described, kind of really resonates with you, fill out the form on the right side or somewhere on this web page. Fill out your name, fill out your email. I'd love to have a chance to talk to you. One of my new patient care coordinators will contact you after you've watched this video. And if you're interested in becoming a patient, we can actually talk to you about how we work with you, okay? Let her know that you're just done suffering, you're ready to get your life back. And like I said, what she'll do is she'll set up a free 15-minute phone consultation with you. And this way we can talk, we can see if this is a good fit for you, if this program is right for you. And if it is, together we will figure out what's wrong with you. We'll figure out what's robbing you of just those precious moments in life. And then we'll develop an action plan, okay? An action plan designed to help you enjoy the things in life that bring you pleasure, okay? I hope to be working with you in the near future. I'm Dr. Hagmeyer. Take care.